Okay, hello everyone and good afternoon. My name is Sue Hinds and I'm the Head of Services at Dementia Carers Count, and I will be the host for this afternoon's Facebook Live with Dr. Raja, our practicing elderly and dementia care specialist, who, as many of you who've been to our Facebook Lives before will know, has joined us on several occasions before, and I know his Facebook Live are really valuable to people and he gives us such wonderful information. Just as a recap, before now, Dr. Raj has joined me and we've talked about the early signs of dementia. We've talked about the assessment process and how to go about getting a diagnosis, what might happen when you're going about getting a diagnosis, the treatment options that are available after a diagnosis of dementia, but also, so importantly, the emotional support and well-being for the family carer who is going through the journey as well. So today it's going to be slightly different. We're going to have a discussion about what's known as mild cognitive impairment, which is sometimes abbreviated to M.C.I. But before we do start on that, I think I've given you a little bit of an introduction, Dr. Raja, but I wondered if you wanted to say anything more about yourself.
Oh, thanks, Sue. What can I say about myself? I'm an old age psychiatrist who specializes in dementia. I have particular interest in dementia and how it interacts with physical health conditions, end-of-life care in people with dementia, and how to support carers of people with dementia. That's how I got involved in Dementia Carers Count as a specialist trustee. I do run when I can. And I do write books when they happen. So I think that's enough of an introduction about me, I think.
That's brilliant. Thank you. And it's nice to know so much more because, as we say, we've met 3 times before. So it's nice to have just that little bit more background information about what makes you tick and so on. So, as I say, this session is going to be about mild cognitive impairment. We will look at what mild cognitive impairment is, how you might go about thinking about diagnosis, but also about promoting good brain health and preventing mild cognitive impairment. For viewers, please, as always, leave us questions in the comment box and we will try to answer those through this session. If we don't get to all the questions in the session, then either Dr. Raj or myself or someone with the team will come back to you in due course. And if you don't want to put it in the chat and you want to private message us to keep it anonymous, that's absolutely fine as well. And as I say, if we don't get to all the questions or we don't notice it, then we will come back to you afterwards. So kicking off, let's have a look at what mild cognitive impairment is, because I think certainly for me, I'm getting older. I know my memory is slowing down a little bit. I'm slower at lots of different cognitive tasks. So could you tell us the difference between normal aging and just getting a little bit slower with the brain and mild cognitive impairment?
Absolutely. So I think the introduction that you gave is very important because we need to understand that brain does age just as every other part of our body does. And when brain tends to age, it will tend to slow down. It will struggle sometimes with having the ability to focus attention might be difficult. The ability to learn sometimes new information might be difficult. For example, it's extremely possible these days to have a different type of TV setup, and we will all struggle with trying to get various things sorted on the TV in the very first instance, because it's a new thing. So, and surely an aging brain will struggle with that too. People's reaction time to things might slow down as well. Their ability to be fluent in conversations might slow down. And these are normal aspects of an aging brain. And we need to appreciate that in the context of the age of the person as such. Some of the things may not actually change that much. For example, things like how we cook, how we drive a car, for example, that kind of procedural tasks will not change that much with age. So aging brain is generally a slowing brain, but it will be able to carry out tasks if given adequate space and time. So that is normal aging process of the brain as such. And therefore it raises the question, what is it then between that and the dementia, and which is where mild cognitive impairment generally tends to sit as a diagnostic criteria. So in the past, we used to talk about dementia, and we talked about the tool Forget to have an understanding of various symptoms of dementia and how people should have a lot of symptoms for at least 6 months, and that should affect their functioning ability to call it as a dementia. So mild cognitive impairment is slightly different from that, in that people will still have some degree of cognitive problems, maybe just one aspect of the cognition being impaired, like memory, or maybe more than one aspect being impaired, like memory or their ability to be quick in what they say or do. But it will not generally impact on their socio-occupational functioning. So they'll still be able to carry out tasks. Sometimes people do ask me saying, well, I never used to write a list when I go shopping, but these days I do write a list. That's absolutely fine. It still says to me that there's a functioning brain there which recognizes the problem and is still able to overcome the problem with something that it has thought through as an appropriate solution. So that is a ticking brain, that's a working brain, which is absolutely fine. So the general understanding of mild cognitive impairment is that there may be one or more areas of cognitive impairment, not to the extent of what we discussed in dementia, but there will not be any degree of occupational or social dysfunction or problem or challenge as a consequence to that. So that's how we can say what a normal aging brain is, which is generally a slow brain, a brain with dementia where things are a problem in terms of functioning ability, and then mild cognitive impairment where there's some degree of cognitive impairment, but it's not really impacting on functioning, or at least yet. And it's very important as an entity in itself, because it's common. It's about, I mean, the studies vary depending on where you look at, but about 12 to 18% of the population over the age of 60 could have mild cognitive impairment, and about 5 to 6% of them might progress to a dementia in 5 years' time. So not all mild cognitive impairment will progress to dementia. Not everyone in the population will have mild cognitive impairment, but it's useful to consider when sometimes there's a cognitive impairment, but it's not impacting on someone's functioning.
Thank you. And I think that's an important thing to remember as well, isn't it? That mild cognitive impairment that isn't always meaning somebody's going to go on and have dementia. The two are separate things. But I think what you've outlined there is a very grey area, and it might be just worth us emphasising it as well for viewers again, so that they're not confused. There is a grey area of what's normal ageing, mild cognitive impairments, and then a dementia where there is a change in sort of socio-occupational functioning that is more in a class with dementia. Whereas normal aging and mild cognitive impairment might have similar features. And I know you mentioned about if you aren't particularly concerned if somebody is now needing to make shopping lists to go down to the shops, but has a strategy of using shopping lists and that's working for them, then that's a positive piece of news really for someone. And I say that because there's a message here from Martha, who said that she has started writing lists for her husband when he's running errands, because of the regularity in which he's forgetting to do various tasks that he set out to. But I'm guessing from what Martha said, those lists are working for him, and he's then able to recall the information. And that he says it, well, she says he's fine, and it's just age. And you're kind of saying, yes, if you're writing this and you're working for you, that's good.
Yeah, working, but it's very good if the brain is able to come up with strategies and see through it effectively. Then it's still a very functioning brain, and that's very important. Equally, we have to understand that there could be other reasons as to why sometimes people might present with some degree of cognitive impairment. Not necessarily because the brain is functioning, but the brain is feeling the heat from something else. Like, for example, say if people have some kind of cardiac condition that compromises the blood circulation to it, like a heart failure, or if people have diabetes and the blood glucose is not really stable, or if people do have a degree of breathing problems, COPD being a common condition in the elderly, all of those will compromise the ability of the brain to function, because brain thrives on oxygen, and if brain doesn't get oxygen, then it will suffer to an extent. So that may present as a mild cognitive impairment, but that's not to say that the brain is dysfunctional as such. It's just that all these things need to be rectified to provide the brain with a better ability to function. And sometimes you could also have people who have other mental health conditions like depression or anxiety, in which case the ability of the brain to focus itself on what's happening may not be as good as otherwise when people don't have these mood-related conditions. So then again, it might come out as a memory problem or as mild cognitive impairment. And again, that needs to be taken into account. So we just need to make sure that brain is functioning, but brain is also being provided with an opportunity to function at its very best. So it means good physical health and good mental health.
I love the phrase that you used there, Dr. Raja, at the start. You said there may be lots of reasons why the brain is taking the heat. And absolutely right. I mean, I'm scribbling notes as you're talking so I can remember what you said. But some of that is my brain taking the heat that we're on a Facebook Live, and that's affecting me. And so I can't think quite so clearly, or I can't remember things because my attention is on other things as well. And I think, you know, like you said, mood, depression, mental health, maybe what's causing the brain to take heat, lots and lots of different things, the hypertension that you mentioned, lots of things that can be getting to the point that makes you feel that you have some level of mild cognitive impairment, or sort of those normal aging changes feel a little bit bigger to you. Certainly, I think, you know as well as me, Dr. Raja, that carers who will be tuning into this, who are caring for somebody with dementia, are perhaps suffering with sleep loss, dietary changes for themselves, mood changes, juggling lots and lots of things. And just to use your phrase again, it can mean that the brain is feeling the heat, really. But it does bring us on then. So how do we go about diagnosing or assessing whether somebody has a mild cognitive impairment? And I'm guessing the first point of call for that would be your GP.
Yeah, so it would be a very similar process for what happens when someone gets referred for an assessment for dementia as such. So it will be GP seeing the person who's presenting with some symptoms of cognitive impairment, completing routine blood tests and the general physical health checkup, just to make sure that some of the things that we've discussed just now, like blood glucose control is fine, the heart is functioning as well as it should, cardiac medications are going in okay. So those kind of the nutrition is adequate, vitamins are fine. So that kind of investigations. And once they're completed, then they will be referred to a memory assessment service, which can vary. It could be a memory clinic, it could be a community mental health team providing that service in a clinic, or it could be a home visit. It could be a mix of various things. But essentially, again, it will come down to taking a very good history of how things started, how it's impacting, or maybe not in certain instances, having a good understanding of the person as such in terms of their life and circumstances, and also completing a cognitive assessment. And it's very important to understand that an isolated cognitive assessment score in itself is not a diagnostic indicator, nor does it say severity in any way. It has to be alongside the history as such, the circumstances, the functioning ability of the individual, all of that put together. And in some occasions, there might be a need for a brain scan to be done, or further neurological tests to be done, like a spinal fluid tap or a genetic test. But they will all be done by specialist clinics as such. So essentially, it's a GP reviewing physical health and blood investigations, referring to a specialist who can then complete a proper history-taking cognitive assessment, and where things need further investigations like scan or specialist neurological investigations. And that will be carried out to try and disentangle, as you said, the gray area of mild cognitive impairment from what could just be normal aging or what could be a dementia as such.
Okay, I think a lot of this aligns very similarly to some of the things that we talked about in the Facebook Live, isn't it? About the assessment and diagnosis and the variation of assessment tools that's available to the practitioners to help support to look at whether you have a diagnosis of mild cognitive impairment or you don't, are similar to those for looking at whether somebody has a dementia or not. There's lots and lots of questions coming in. Just to remind viewers, I am seeing your questions and I will come to them. I'm just going to be putting them in an order that sort of flows so that we can talk about them in the areas that we go into on this. So if somebody has a diagnosis of mild cognitive impairment, or as we know can be abbreviated to M.C.I, what would then be the next steps for them?
So in terms of next steps, I think it's important to discuss about various health promotion activities that they could engage in. We should also talk about a little bit about medications and whether they do any useful service to the individual, and also the need for considering physical mental health activities for the person, as well as support for the carers as such.
I think that would be really useful, Dr. Raj. I wonder if we could talk about the pharmacological or the medications first, because I think if we can then go on to the non-pharmacological treatments, that will take us into where I'd like to go at the end of this session, which is about what we can all do to promote brain health and good brain health as well.
Absolutely, Sue. I think various medications have been trialed for mild cognitive impairment. So the general cognitive enhancers that are used in treatment of dementia, anti-inflammatory medications, vitamins, nutritional supplements, hormonal substitutes, nicotine, and all kind of complementary medication. They've all been trialed in various shapes and forms, but none of them have credible evidence to say that they do alter the course of mild cognitive impairment, or revise the cognition as such. But they will all be useful in many different ways in terms of, say, if someone did really have a vitamin deficiency, then obviously managing that would be a very important aspect. If someone did have poor cardiovascular functioning, then optimizing that, or having the blood pressure, blood glucose, cholesterol, all of them as optimal as it could be, would be very useful, because then it means that blood can flow to the brain, brain can benefit from the amount of oxygen it gets, and therefore all of those kind of treatments would be very useful. And that's why a GP reviewing physical health is a very important step in terms of assessment process itself, because it will lead to certain treatment options being discussed and considered. So that is so far as the pharmacological treatments go. And equally, I think if someone did get diagnosed with depression or anxiety along the way, then they will have to have appropriate degree of pharmacological treatment for that.
Okay, that's really useful. So some of what you're saying, Dr. Raju, is some of the pharmacological interventions that people have in maybe for other conditions, or other physical or mental health conditions, having a review of those can be really important for maximizing cognitive ability for somebody who's got a mild cognitive impairment. And it's going to, in a minute, take us on to those more health promotion and non-pharmacological treatments. But I've got one comment here from Caitlin. I hope I said your name right, Caitlin. Can alcohol bring on M.C.I or make it worse?
So alcohol can lead to a lot of mental health conditions, including dementia as such, because it does damage quite a lot of important brain circuits and areas. So in that sense, it could be a predisposing factor for an emerging cognitive impairment, including mild cognitive impairment. One of the things that I was going to say anyway, in terms of health promotion, will be managing alcohol use as we all get older. Obviously, there is guidance on how much to drink depending on age and things like that. But generally speaking, alcohol is a depressant, so it can lead to depression over a period of time. Alcohol also impairs cognition, and therefore we need to be very careful when someone gets diagnosed with mild cognitive impairment or dementia, because it will be detrimental to their cognitive ability.
Okay, thank you. And just before we move completely off assessment and treatments, there's one comment that you might decide that is better to answer afterwards, but I'll put it in now. Angela says that her husband has memory tests and has scored 87 on his memory tests and has been diagnosed as with mild cognitive impairment. So for her, does that mean he has significant impairment or not? And I think this is where it's depends on.
Yeah, I think this is where I think it's important not to interpret a test score in isolation as such. 87 for one person would be 87 for a different person. So I think it's more about understanding how those laws of, for example, it might be 13 points, actually cause problems or doesn't cause problems. That would be more to understand and see if it is a problem, how could it be dealt with? Could some modifying strategy be put in place and therefore things could be managed effectively? Or is this something that is going to be progressive? Because hopefully I think we'll be able to talk a little bit about what kind of things might predict a mild cognitive impairment progressing towards dementia once we've discussed more about the treatment options.
Okay, thank you. Thanks, Dr. Raja. But it is important, isn't it? It's you might lose 13 points on a scale, but it's how much is that affecting you in your day-to-day procedures and things like that. Okay, thank you. So let's go on to some of those less pharmacological interventions for somebody who has mild cognitive impairment. And it will link in, I'm sure, with actually what's just really good brain health for all of us as prevention.
Yeah, I think that's the most important thing. I think it's more about promoting good brain health, and that is a very positive way of looking at the interventions as well. So the first thing to focus would be on good physical activities. So physical activities that improve flexibility, strength, balance, endurance. So essentially things like Pilates, yoga, that kind of stuff, or running. All of those would be very helpful because it keeps the circulation going, and it's very important for the brain to be nourished adequately enough. So that has been proven to be very effective in terms of brain health promotion. The second important thing is to have cognitive activity, not necessarily a challenge in itself, but things that people enjoy doing. So and I think it's also important to stress that we don't want people who don't do crosswords to suddenly start doing crosswords. That's not the point. The point is that if people do enjoy intellectual cognitive activity of any kind, it could just be reading a book, because that in itself is an important brain related activity. It could be that some people do Sudoku, which is fine, they could continue doing it. So it's more about cognitive activities, which will then enable the person to improve their attention span, have the ability to have that degree of flexibility in their thinking and logical thinking patterns, and also improve upon their memory. So, or drawing from their kind of long-term memory as such. So I think those kind of cognitive activities, which people are familiar with and can still do, if we were to encourage them to continue doing that, then I think that would be a very useful way of managing mild cognitive impairment. Alongside that, there are some consensus opinion on what could be helpful in people with mild cognitive impairment. So we talked about reducing or abstaining from alcohol, which would be very useful. Stopping smoking would be a very useful way to manage better mental health. Improving sensory functioning, so people having regular vision and hearing tests done and trying to rectify any of those things, that would be very helpful. Having regular review of their physical and mental health, so they're on the right medications, and more importantly, having appropriate number of medications, because it's not uncommon for elderly people to be on many medications, which may not be really necessary and which may cause a lot of drug interactions. So I think it's important to be very thoughtful about that, and generally promoting a sense of social interaction, stimulation. All of those would be very helpful for a positive brain functioning as such.
Brilliant, thank you. So we've got there really essentially what's good for the heart is good for the brain. And
Yeah,
then,
absolutely.
yeah,
Absolutely.
and then all of those things around having a physical health check, mental health checks, making sure your medication's right. Really importantly, sometimes I think we fail to make the connection between vision and hearing. So having those vision and hearing checks and getting spectacles, hearing aids, whatever it
Yeah.
is you might need to support
Yeah.
if there's difficulty there. So I think those physical health reviews are really important. And the other one I'd like to mention, and wonder if you've got a comment, and would be sleep and sort of good sleep patterns.
Yes, having a regular sleep pattern and promoting good sleep hygiene is very important, um, especially because brain needs to rest and have adequate amount of rest. And a brain that's very has rested very well will feel refreshed the following morning. And we would all have noticed that we would all be grumpy in the morning if we hadn't had adequate sleep, and that's because brain is just telling us that, you know what, I'm very tired, leave me alone. So I think it applies for mild cognitive impairment as well. So having refreshing sleep is very important.
And there is quite a lot of information in our website about sleep and good sleep hygiene. And certainly our clinical psychologist, Dr. Jemima Fitzgerald, has written some articles in there that can help people. But I'd just like to reiterate again, going back to your phrase about your brain can feeling the heat, that, you know, I'd mentioned the carers before now, when they talk to us in our live online sessions and our face-to-face sessions, say that they're worried about their own cognitive health. And often that comes because a family carer who is supporting somebody with dementia might be having reduced sleep. They might not be looking after their own physical and mental health needs quite as well. Very busy doing the reviews with the doctors for the person that they're supporting, and the hearing checks and the vision checks for the person that they're supporting, but not necessarily really putting their own oxygen mask on and thinking about themselves. And that oxygen mask isn't just important so that they can look after the person with dementia, but it means they're looking after their own brain health. And
Absolutely.
I just want to read out, and for you to come back, is sort of in terms of what I've said. And this person said, Andrea has commented, she said that her mum has really started to struggle because she's getting the brain heat from looking after Andrea's dad, who has dementia, and that just goes along with it, doesn't it?
It does, and that's why we've always emphasized on having an appropriate carers assessment being completed as part of any mental health assessment, not just for dementia, for any mental health condition as such. And that will unearth some degree of depression, anxiety in the person who's caring, and that needs to be looked at and treated as well. And I think that's why I think it's important for people also to look at some of the online resources that we have on the Dementia Carers Scan website, which is useful towards carers understanding what kind of distressing symptoms they might experience and what they will have to do in terms of getting the right degree of help and support. We talked about heart, and I think stable relationship is good for the heart and good for the brain. So I think it's important to emphasize on the importance of carer stress as a predictor for the mild cognitive impairment or dementia progressing itself.
Yeah, but also just to say as well that lots of the cognitive changes that we see as we get older are normal. Some might be mild cognitive impairment, and carers might experience sort of more cognitive difficulties. It doesn't mean that that's equivalent to going on to get a dementia. They're separate conditions, aren't they? And that they're, you know, if you do need support as a family carer on ways to reduce the stress in terms of strategies of how you support somebody with dementia, your own sleep, your own well-being, your own resilience, as you say, Dr. Raja, there's lots of information in our website, and a whole section on health promotion actually that looks at those preventative measures and some of those things that can help in terms of reducing alcohol, increasing sleep, finding strategies to look after yourself, and so on. It's been really useful talking to you yet again, Dr. Raja, in today's session. And it does bring us to the end of the session again. 30 minutes has gone very, very quickly. And thank you for joining us once again. Please, if you're listening to this, do look at those online resources that we've referred to today and the various online sessions that we have up and coming in over the next few months. Thank you for joining us both, and we will continue with some more carer clinics with Dr. Rajas, and I know the next one will be looking at the complexities of thinking about if somebody's going to move into the care home or into a care home setting, the complexities of that, and we'll let you know the date of that as soon as we've managed to secure the date for that. So thank you, everyone. Dr. Raja, I'm just going to leave final comments to you. Is there anything final that you would like to say to viewers at this point?
Well, I think it's important to ensure that we do our very best to promote a healthy brain, and that will come from us managing our nutrition, hydration, our physical, mental activities, as well as getting our social contacts organized in a better way, and that will enrich the brain, and that will help us to help the brain in a better way.
Okay, thank you so much, and hope to see everyone again soon. Thank you.
Thanks, Sue.